Our guest today is Vineet Singal, co-founder and executive director of Anjna Patient Education, an organization that seeks to educate people about health and diseases so that they can make their own decisions and using technology as the medium to reach them.
The mission of Anjna Patient Education is to work to solve the problem and the very epidemic problem of chronic disease in America. And this is a problem that has recently gotten a lot of play in the media, but not so much from the perspective of chronic disease for the underserved population. And by that I mean people who don't have health insurance and people who often visit what are known as free clinics. We currently operate out of Stanford. That's where we are. We also have a chapter at UC Berkeley and a starting chapter at San Jose State University. Yeah. It was my sophomore year in high school or in college, and I was thinking to myself, what it is I wanted to do, and I mean, I personally lacked something that a lot of my other classmates had, which was a passion, a calling, and I wanted to find that for myself. Yeah. And I knew that there was need back home in Galveston. We had just been through a hurricane. There had been so many people who had lost their jobs, so many people who lost their health insurance, that we needed, people needed help. And so I decided to take a quarter off from Stanford and work full-time at this free clinic, just volunteer there. And I was the only full-time volunteer. So my role began as just shadowing and just helping out with charts and everything, but it grew into something more meaningful for me. I mean, I started seeing patients, started doing vital signs, physical exams, taking their histories, doing point-of-care testing, and then eventually decided that I had seen so many patients, go through chronic disease that I, had to do something. And it wasn't just a big problem for me, it was a personal problem. Because when I was 18, I had been diagnosed with what is known as pre-diabetes. I was 225 pounds, BMI of 34, which is, obese, significantly obese. And I lost, over the course of 2 years, I had lost over 75 pounds.
If our viewers want to find out more about the organization, get involved, similar to what Stanford faculty have done, where do they go?
The website is anjna.org, anjna.org. They can also help volunteer for the organization. There's various different opportunities, translation, graphics, spreading the word, contacting clinics. We have created this network of 250 volunteers who have devoted over, these are not only students, they're graduate students, they're alumni, there are faculty mentors and doctors and physicians and nurses from various different places from around the world, around the nation actually, who have devoted over 15,000 hours of volunteer time to 3 of our projects. The first project has to do with creating health education information that is accessible and specifically designed for patients at free clinics. The way this project works and the way these interactive modules work is that they combine animated characters who are going through a disease, and they, it follows the journey of that character throughout the character's life. Interspersed with videos of actual people talking about their experience with chronic disease. And we call this Project Not Alone. And this interactive module, the entire time the patient is plugged into this tablet computer, and after every single, you could say, module, they're given a quiz. So it tests their understanding, and it presents material based upon that understanding. The usefulness of this technology is most apparent when you consider the time that is wasted when when a single patient visits a clinic, especially a free clinic. They waste about 3 hours just reading Time magazine, and we believe that the time that is wasted essentially waiting for the physician can be utilized for positive education, so that the patient is more aware about their disease, and they're more inclined to ask questions of their physician when they're actually in that examination room.
There's already a lot of information out there for patient education. I can go to any of the major hospitals or government clinics, and there's always these brochures lying around. I can go to Mayo Clinic website and find information. So what is it that you are doing that is new, unique, and different?
So we take all of that information that is existing, that is out there, the Mayo Clinic, the American Heart Association, the American Diabetes Association, and we condense it, and we take the most salient facts and simplify them using very simple language, and we translate it into various different languages. And we use a lot of images. We have a huge team that is focused exclusively on translating complex medical information into images that can be understood working with the Vietnamese population, a big problem in the Vietnamese community is high blood pressure.
Yeah.
And a major contributor to that is Vietnamese sauce, which is an ingredient in a lot of Vietnamese food. Vietnamese sauce is extremely high in salt. There's a recipe for Vietnamese sauce that uses a quarter of the salt and uses additional spices and everything. And
Still tasty.
tastes the exact same.
Yeah.
Making that one change can reduce the chances of someone who's Vietnamese to develop hypertension. Cutting down on soda from four cans a day to 1 can a day might be difficult at first, but if you can do it, that cuts down the amount of sugar you're having per day by almost 50, 60 grams.
Okay.
Stress is a major contributor to a whole host of diseases, including depression. Our focus is specifically on ensuring that patients take the right steps once they find out about their diagnosis. And what's a single most important example is something as simple as taking your medication after you're diagnosed as being depressed.
Okay.
A lot of patients, what they do is they stop taking their medication because they feel better. And that often results in even worse outcomes for the patients.
What keeps you going? Where is that inner drive coming from?
It's my parents. I mean, they have been role models for me throughout my life. They are both physicians and they work tirelessly for patients every single day. And I mean, they are my inspiration.